Bird flu in the dairy industry has reached a critical point. The threat of bird flu, long simmering beneath the surface, is showing alarming signs of escalation. Recent developments suggest that the highly pathogenic avian influenza H5N1 is spreading more aggressively among animals with concerning implications for human health. NBC News' Evan Bush reported this year has been marked by a series of concerning developments in the virus's spread. Since April 2024, at least 65 people have been tested positive for the virus in the United States, a stark contrast to the single infection reported in 2022. Dairy cow herds in 16 states have been affected, and last week, California Governor Gavin Newsom declared a state of emergency in response to widespread outbreaks in poultry and cows. Most strikingly, the Centers for Disease Control and Prevention confirmed the country's first severe bird flu infection in a critically ill patient in Louisiana. Dr. Peter Chin Hong, an infectious disease expert at the University of California, San Francisco, issued a grave warning. The traffic light is changing from green to amber. So many signs are going in the wrong direction. While no human-to-human transmission of H5N1 has been documented so far, experts have identified several troubling indicators that the virus may be evolving towards becoming a pandemic. The first sign is uncontrollable spread among animals. The virus is infecting a wide range of animals, including dairy cows, frequently in contact with humans. The second is diverse environmental detection. Traces of the virus in wastewater indicate it's leaving a broader imprint than previously understood, extending beyond traditional farm settings. Third is mysterious human infections. Some human cases have emerged without a clear source of infection, raising concerns about undetected modes of transmission. And fourth is viral evolution. Studies have shown the virus is mutating in ways that make it better suited for the infection of human receptors, requiring fewer changes to facilitate human-to-human spread. Together, these developments suggest that the virus is inching closer to becoming a major public health threat. Despite the escalating crisis, the U.S. government's response has faced sharp criticism. Amy Maxman of KFF Health News reported that many experts are disheartened by the government's handling of the outbreak. The USDA recently ordered a nationwide milk testing, a move welcomed by researchers but criticized for being months overdue. Tom Boylick, director of the Global Health Program at Council on Foreign Relations, highlighted the repeated missteps. It's disheartening to see so many of the same failures that emerged during the COVID-19 crisis being reemerged. The impact of the bird flu virus isn't limited to farms. NBC News' Doa Bedin reported a voluntary recall of raw and frozen pet food after a cat in Oregon died of bird flu. The contaminated food was linked to a highly pathogenic avian influenza strain, underscoring the virus's reach beyond traditional agricultural settings. Experts warn that controlling the virus is still possible, but the cost and complexity of containment have skyrocketed. A sluggish response to emerging outbreaks may simply be a new unfortunate norm for America. Boylick remarked, "For now, the immediate public health risk remains low, but the signs of a worsening crisis are clear." The evolving bird flu crisis serves a stark reminder of the need for robust, proactive measures to prevent a future pandemic. With the virus spreading among animals and sporadic human cases being reported, the window for effective intervention is narrowing. The question is whether policymakers, scientists, and the agriculture community can work together swiftly enough to mitigate the threat before it's too late.